for our nation. In some cities like LA, which is probably one of the places that get the most homeless, is like at any one time 57,000. That's one in every 250 residents of the county is homeless. In Chicago, we tend to measure it through one-time counts, and anywhere from 5 to 10,000 at any one time. So the problem continues to be a huge problem, even though we've been trying to, over the last years, creating more housing and more services. Again, a lot of people tend to lump persons who are homeless into one big category. There's really, different categories, not just, gender groups or ethnic groups, but short-term, long-term. Most homeless people are short-term, and they're homeless for a few days, a few weeks, and, with the help of rental check or utility support or whatever, helping somebody find low rent apartment, they get out of homelessness. Most of the time, those individuals are not seen that much in the public. At the other extreme is the long-term homeless people who've been in the streets for over a year. Many of them are struggling with illnesses, substance use or alcohol use histories, and other challenges. So let me focus on especially a long-term group. In between long-term and short-term, there's people who are, if they're not helped in the short term, they could end up in a long-term group. But especially the African-American community is way overrepresented in homelessness in Chicago. Just to give you an idea of the single adult population, 70% of is African-American, which is twice the percentage of people as far as the average in the city. And also among the youth, gay and lesbian and transgendered youth are way overrepresented in homeless youth. And a lot of people tend to say, well, what's wrong with them that they're overrepresented? One of my fellow social workers that I heard at one presentation used the metaphor of painting. You have portrait paintings and you have landscape paintings. In a portrait, of course, you see the figure of a person. In a landscape, you see more the setting around the person. A lot of people focus when it comes to homelessness on the portrait. What's wrong with this person that they're homeless, as opposed to the landscape: lack of affordable housing, lack of access to good health care, lack of income, sustainable income, lack of opportunities, stigma, discrimination. And one of my favorite ways to describe what causes homelessness is the failure of multiple systems. It's not just one system, the housing system, there's the healthcare system, there's other systems that don't do very well, the criminal system, foster care system. We talk about how in our nation we have to make sure that as we really attack homelessness and try to create more housing units, that the foster care system, the prison system, the hospital systems don't keep dumping people into the homeless sector. So we have to close that door. They're supposed to be taking care of their own. It's tough enough to take care of those who are already homeless. One of the things I wanted to focus in a little bit then is one of the challenges that has been occurring, not only in the city but around the country, is that since about 12 years ago, the federal government began really focusing on the long-term homeless. People who had been on the streets for a long time, serious mental illness, long-term substance or alcohol use, because they're the ones who were costing the system the most, and if you attack that issue, hopefully you can have more resources for the others. Well, part of what happened is that the youth got left out because many of them were just starting their homeless trajectory. But lately, in the last 2-3 years, they began to really focus a lot more, and we have a little more resources, certainly not enough for it. So we need hundreds of housing units, stable housing units for youth. We need thousands for people still with mental illness and long-term substance use. One of the things that's promising now is that with healthcare reform, and most people who are homeless, no income or low income, being able to get into Medicaid. When I was in Interfaith House, the first 10 years of my stay here, only about half the people had health insurance. The other half would have to rely on the mercy of county hospital healthcare systems. But now with everybody being insured and medical providers, treatment providers not being paid for just volume based, they're not going to get paid fee for service. They're going to get paid for outcomes. They have to produce outcomes, reduce unnecessary cost, produce good health outcomes. They're all of a sudden they're recognizing they need our housing units in order to keep people healthy. And so there's an opportunity that hasn't been there before. And I'll end with one example in LA County. LA is just came from a presentation in DC last week, where LA County, the Department of Public Health that funds all the public health hospitals and other services, is going to be creating 10,000 new units, what they call supportive housing over the next 8 years.
Wow.
The way they're doing it is they realize that if they put many of these people living in the streets, including homeless youth, in good housing with good services, the hospitalizations will go down, the emergency room visits will go down, the nursing home stays will go down, and they'll be saving literally millions of dollars. The issue is then how to shift money from the healthcare system to the housing system. So they decided as a public health institution, the Department of Public Health in LA County, who has a $10 billion budget. Incredible. LA could be its own country. LA County. They're basically saying we're going to create housing. We're going to be both housing for the highly vulnerable individuals, including youth who are highly vulnerable and adults. Youth usually 18 to 25. And they just started, so it's a wonderful experiment we're watching. We would love to see it here in Cook County. Cook County Hospital and the Cook County healthcare system also way overspends on this population. That, in a sense, that they wouldn't need to do that if they had housing. So it's something that we're looking at, and hopefully it will give some hope that we can attack this horrible challenge that we have. And we very much are very supportive of projects that help people with things like laundry, transportation, but of course the end goal is to get them to stable housing where they don't have to be jumping from one place to the other. So that's my 10 minutes.
That's right.